So here we are at Chapter 6, where we are going to begin to look at writing the mission statement and crafting goals and objectives for our health promotion program plans. So the whole idea of program planning is to be clear about the problem. And how about So here we are at Chapter 6, where we will begin to think about establishing our mission statement, outlining goals and objectives for our health promotion programs. So the whole idea of program planning is to be clear about the problem. And how about everyone is going to work together to address the problem? Planning is a bit like paying it forward or making an upfront investment, which can save time, money, and ensure a greater possibilities for success, as compared to simply charging along and doing something. I don't know about you, but I've worked with an awful lot of groups who, with great enthusiasm and a lot of energy, charge forward to do something. And sometimes what ends up happening is that we discover people have a different idea of what the problem is. So they're setting out to solve 2 or 3 different problems. And people tend to get frustrated and feel like there's no leadership and things are just running amok. So having a good plan is really important for success and for everyone to stay involved and for all people's assets to be really used effectively. I think of good planning much like this diagram of laser lens. It helps to cut through stuff. So all the different light beams are people's efforts. The planning framework becomes the lens that focuses this high-powered laser beam that can cut through stuff, or in this case, the health promotion or health education or health problem that we're working on. So a mission statement, goals, and objectives provide a foundation for planning. They provide direction for any planned effort, and then they also provide a basis on which to evaluate the outcomes, which is a really important role of the program plan. Sometimes in this process we need to revisit our research literature to stay on top of questions as they emerge. We've done a basic bibliography, we've gotten an idea of exactly what problems we're trying to address and the target audience for that. But again, this is a circular process and we have to start somewhere, and starting with a needs assessment and establishing a mission is a good place to start. But as we begin to craft goals and objectives, sometimes we have to go back to that drawing board and just refine our understanding of the problem and the target population. So you can expect the need to do that as we move forward. So the mission statement is also called the program overview, or sometimes the aim. It describes the general focus or purpose of the project. It might also reflect some of the philosophy or the ethos behind the organization. And as we look at some examples of mission statements, I think you'll see that. The mission statement can also help to develop the goals and objectives, not to be confused with a vision statement. A lot of times in various organizations you'll see both a mission statement and a vision statement. You may even find a values statement, and the values statement is really where an organization will define its philosophy or its ethos. The vision is a bigger idea of what things will look like in the future if the mission is accomplished. For this program plan, we're going to sit with a mission and goals going forward. So for example, the mission of the Walk Up Health Promotion Program. If you were to look at this from 2 different possible target audiences. The first is a community setting example. So the mission of this Walk Up Health Promotion Program would be to provide a wide variety of primary prevention activities for residents of the community. Or if it were applied to a different context or setting, for example, healthcare setting, the Walk Up Health Promotion Program's mission is to help patients and their families to understand and cope with physical and emotional changes associated with recovery following cancer surgery. So, same program, 2 different audiences, slightly different contexts, and the mission would sound different. So from the mission statement, we then can begin to look at goals. Goals are less specific than objectives, which are coming, and are used to explain the general intention or intent of a program. So a goal is global and general. It provides an overall direction. It's beginning to focus the laser beam. It takes a relatively long time to complete. There's really no deadline established with a goal. It's usually not observable or may not be directly measured in exact terms. It identifies a desired change and who that change is going to be for, or for whom that change will be. So you can see that I've underlined the desired change and I've put for whom in red. So if we look at the next slide, you can see some examples of program goals. To prevent the spread of HIV in the youth of Indiana. The what is preventing the spread of HIV, or the change, and the who is the youth of Indiana. Increase the consumption of locally grown produce among the residents of Delaware County Home. That would be a senior citizen center. Reduce the incidence of cardiovascular disease in the employees of Smith Company. Or decrease sedentary time in the workday of PSU employees. That was the mission for our recent On the Move campaign at Plymouth State University. Increase self-confidence in young girls identified as at risk in central New Hampshire. This is one of the elements of the mission, of the goals in the Circle program of Plymouth. So for your own information, I encourage you to look at the 5 goals that emerged in the needs assessment process for Healthy PSU. And we can actually go to that website and look at those goals. So on the Healthy PSU website, you can see that our mission, this is a worksite wellness campaign, is that Healthy PSU seeks to promote a culture of positive health by providing leadership, opportunities, and support for all PSU employees and their families, encouraging health and wellness in varied ways, and thereby building healthy people in a healthy place. Now I'm asking you to think about how this mission reflects some of the values or the ethos that Plymouth State University is setting into place with this program. For example, we fully intended the program to embrace and include families. We wanted it to embrace and include all PSU employees. Even though it's funded primarily for full-time benefited employees, we allow all part-time as well as full-time employees to participate in the campaign. We talk about encouraging health and wellness in varied ways, and so this was designed as a community-based participatory project where we really got the participants to start building the program and building the essence of the program through our needs assessment, which was focus groups and surveys. And so varied ways of addressing health and wellness issues is built into the ethos of this program. So it's only one sentence, but it accomplishes a lot of communication in terms of really setting the groundwork for the entire program. The goals then are 5. Number 1 is to establish leadership and increase employee knowledge of and engagement in a culture of wellness at PSU. So the what is establishing leadership. The who is for employees. Number 2, increase opportunities and access for regular to vigorous physical activity for all employees. So we're increasing physical activity for employees. The third goal is to increase opportunities for employees to have a health-promoting diet. So we are increasing opportunities for employees. And number 4, reduce employees' perceptions of work or environment-related stress. So we are reducing perceptions of stress in our employees. And finally, number 5 is to identify and implement strategic policies to reduce or minimize the rate of increasing employee health care benefits costs. This is a big goal. So we're identifying policies to increase employee health care, or to help to control the rate of increasing employee health care benefit costs. So 5 goals, and You can see the plan if you wish. This is a hot link to the plan, and it's quite extensive. I posted the original plan that was written back in 2012, and it was a 5-year plan to go from 2012 to 2017. So we're in the 4th year of that plan now. And what is posted here on the website is an updated version of that plan. So if you'd like to see what a comprehensive worksite wellness plan looks like, it's right here at good old Healthy PSU. So back to our slides. So I also have rounded up a group of organizations that all have mission statements, and I would invite you to Google these mission statements for these organizations or any others you may know of in the health promotion business and see what they look like. You might also find the goals listed on their websites. I've actually picked out a couple of these that I wanted to show you. So I'm going to close the slideshow and jump to, here's a really interesting one. This is the website for Heal New Hampshire, or Healthy People, Healthy Places. This is an organization that's funded by the Healthy New Hampshire Foundation and has been in operation now for pretty close to 10 years. It's a very robust organization that's having some really significant impacts on the health of people in the state of New Hampshire. So I'm going to go to the About Us page. I'm going to try to go to the About Us page. Let's go back to home. Actually, that's how to connect with them. Here it is, under Healthy People, Healthy Places plan. So if we look at the plan, we can see that they have a strategic plan for 5 years also. And their plan has overarching themes. They have goals and objectives, and down here is their vision. So mission isn't really clear here, but I did want you to see the vision statement, that New Hampshire will have healthy people and healthy places, and the residents will have options to make healthy choices. And they then have created goals for both active transportation and recreation, and a goal for healthy food. So this entire 5-year plan has only 2 goals and only 4 objectives. So goals and objectives really can be pretty simple as long as they're specific, and it gives everyone in the group a clear understanding of where we're going to address the problem. Another organization I wanted to share with you was the American Heart Association, also probably a very well-known organization to you. And it's a little bit hard to find their mission. I had to go all the way down to the bottom to find the About Us link. And from this, you can begin to see their mission, which is to build healthier lives free of cardiovascular diseases and stroke. That single purpose drives all we do. The need for our work is beyond question. Simple mission, but very direct. And they add a little bit of extra to this below, where they talk about what we do. And so what we do is more typically a mission. That would be to improve the lives of all Americans. We provide public health education in a variety of ways. We're the nation's leader in CPR education training. We help people understand the importance of healthy lifestyle choices. We provide science-based treatment guidelines to healthcare professionals to help them provide quality care to their patients. We educate lawmakers, policymakers, and the public as we advocate for changes to protect and improve the health of our communities. So a little bit longer paragraph. Sometimes a really short mission statement, like they have at the very top of their webpage, is almost more of a slogan than a mission statement. So mission statements can be large, they can be small, they can be in between. The idea is to be very clear about what the program is doing. And finally, here's one for those of you down in Connecticut. This is the Connecticut Health Foundation. And this foundation also has a lovely mission in the About Us section. They don't actually call it a mission, but it basically tells us what they do. They are passionately committed to creating more access to better quality health care for populations of color and underserved communities across Connecticut. Not only that, but we're dedicated to doing it by fundamentally changing the healthcare system to make quantified, sustainable change with tangible impact. So that is a pretty aggressive mission for this foundation. So as you begin to, I would really like you to look at a couple of those organizations that I've listed on this slide and just begin to practice reading mission statements and goal statements so that when it comes to you writing them for your program, it'll be easier. So objectives then, which is the green box or the third level of planning at this stage, objectives are more precise than goals. They represent smaller steps that lead to reaching goals. They outline very specific changes to occur, and they're written in measurable terms. In other words, they can be measured. And some of you may have used the acronym SMART, S-M-A-R-T, and in this framework that we're using for this class, objectives will be SMART objectives. And there are several levels of objectives that can and should be used in program planning. So the types of objectives that we think about when we're writing a program plan are process and administrative objectives. They are impact objectives, which come in three forms: learning, behavioral, and environmental. And finally, outcome objectives. So process and administrative objectives in the program are activities and tasks that have to be done, where impact objectives deal with, in terms of learning, with awareness, knowledge, skills, and beliefs. In terms of behavior, it's where old behaviors are exchanged for new or healthier behaviors. And then if it's an environmental objective, it deals with a change in the built environment or a change in some kind of policy, whether it's an employee policy in a work site, a community policy, or maybe a larger public policy. Establishing a tobacco-free campus, as we've done at Plymouth State in this last couple of months, is an example of an environmental objective that Healthy PSUs set out to accomplish, and we have done so. We have established a tobacco-free campus policy. Outcome objectives then are really large changes, such as change in quality of life, change in health status, changes in risk, and then social benefits. So these are bigger outcomes that come in a community where programs are being implemented. So the types of evaluations that go along with these objectives, if you're looking at process and administrative objectives and whether tasks and activities happen or are accomplished, that's usually a formative evaluation. Those get evaluated as the program is being implemented. The impact objectives then are summative. They look at what the impact of these interventions or activities actually were. And an outcome objective then is looked at in terms of the overall outcome. And that usually is done qualitatively and quantitatively. So there are measures that can be used to actually determine whether those outcome objectives were accomplished or not. So the criteria for developing objectives, in other words, SMART objectives. As I mentioned, you've probably seen this acronym where an objective needs to be specific, it needs to be measurable, have something related to it that can be measured, achievable, realistic, and time sensitive. And as we move through the chapter, I think you will find that the authors of our textbook have done a really nice job with setting up a process for developing objectives. The first thing they've done is to identify the elements of an objective. And I've put these in red here, where the elements are that an objective will describe the outcome to be achieved or what change will happen, the conditions under which the outcome will be observed, the criterion for deciding whether the outcome has been achieved or how much has changed, and then the priority population, or who will change. So some examples. The outcome to be achieved, or what will change, the action, behavior, or something else. Apply, the words we use in these objectives might be apply, argue, build, compare, demonstrate, evaluate, exhibit, judge, perform, reduce, spend, state, or test. I'm sure you've seen these in the syllabi for your various courses. In the teaching profession, I'm sure you're familiar with these in terms of learning outcomes or objectives for students, and we use these in program plans as well. The conditions would be when or in what circumstances upon completion of the exercise class or as a result of participation. The criterion gives an idea of how much change will occur, or by 10% over baseline, or 300 pamphlets that may have gotten distributed. And then the priority population, or who will change, would be the teachers, the employees, the students, the participants, the parents, the children, whatever. So as we move through this process, for health promotion program planning, we think in terms of these 5 types of objectives, and they're listed from low to high in terms of their importance. And there are several subtypes within those. So process being the lowest level of importance, it's nice to evaluate your process to do continuous quality improvement, but it's less important than the highest level of importance, which would be the outcome. What are you going to look for in terms of an outcome for your program? So we have process, impact learning, impact behavior, impact environment, and then outcomes. A solid plan covers all the bases and includes objectives from all these areas, with a focus on the higher level objectives. So the outcome, the what, plus the priority population, the who, the conditions or when, the criterion, how much, gives you a well-written objective. So what, who, when, and how much. If you can make sure that in your sentences that describe program objectives you have what, who, when, and how much, you will have a solid objective. So action words work very well, and we want to use measurable terms. So I want you to look carefully at box 6.4 in your text, which lists a variety of, I have to just check my book here. If you can be sure that your objective sentences include the outcome or what, the priority population or who, the conditions or when, and the criteria or how much, you will have a well-written objective. What, who, when, and how much, all in one sentence. A well-written objective. So I would like you to look for sure at box 6.4 in your text, which has outcome verbs for objectives, a whole list of the different kinds of verbs that can be used in writing an objective. The verb must refer to something measurable and observable. That's what makes an objective specific and very different from a goal. Some words work better with certain levels of objectives. For example, a list is one kind of objective. Explain is a different kind of objective. Who is going to do what, when, and to what extent? So here's an example of an objective. When asked over the telephone, one of 3 viewers of the Heart Special television show will be able to explain the 4 principles of cardiovascular conditioning. There's an objective. So who is the target? Who have we got here? What is the outcome? When are the conditions, and how much is the criteria? And then I'm asking you, what type of objective is this? Is it a process, an impact learning objective, an impact behavioral objective, an impact environmental objective, or an outcome objective? What do you think? So let's break it down. During the next 6 months, here's another one. 300 community residents will participate in one of the health department's health promotion activities. So another example of an objective. So what I've done is I've color-coded each part of this objective so we can just see it very, very clearly. So during the next 6 months, that's the when or the conditions, 300 community residents, target audience or who, will participate in the health department's health promotion activities. That's the what. And finally, the measurable criterion is one. 300 residents will participate in one of the health department's health promotion activities. So in the criteria for developing objectives, planners also need to be realistic with regard to the other parameters of the program. So the questions you might want to consider when you come to implementing a program or even developing the objectives of the program. Can the program actually happen in a reasonable time frame? We set out to launch the Soulmates walking program this summer, and I'll tell you, we did program planning for that program in record time. I think we did it in 1 week. There were 4 of us involved, and that was one of the biggest questions. Can the program actually happen in a reasonable time frame? Can we get it to happen in the month of July and August? Can we get this out to participants? Can we get it marketed and promoted? Will we have access to the space at the times that we need? The answer to that question on all counts was yes, so we did it. Can the objectives realistically be achieved? Well, given the time frame that we had to do the program, we made sure that the objectives could be realistic and realistically achieved. Does the program have enough resources to obtain the objective? This was another question we had to look at really carefully in terms of balancing objectives with resources. Could we have pedometers for everyone? Would we have the training staff available at the times to deliver the interventions? Would we have the space and facilities when they needed them? Again, we were able to answer yes, and the program is happening. Is it consistent with policies and procedures of the organization or the community? So the organization involved with Soulmates program is Midstate Health, partnering with Allwell North and the Center for Active Living and Healthy Communities. And again, policies and procedures lined right up for these organizations. Do the objectives violate any of the rights of those who are involved? We had to think carefully because the people involved in this program are patients at Midstate Health. There are some privacy concerns. We needed to get very specific photo release permission forms signed, and we had to be very careful to deal with the privacy of these individuals in terms of their health conditions. Does it reflect the cultural characteristics of the priority group and the changes sought? Well, again, cultural characteristics, we had to be sensitive to the needs of these patients of Midstate Health. We had to be mindful of the culture of Allwell North and what's going on at the track in terms of its use by other organizations and groups. And we were able to align the cultural characteristics of both groups, and it did reflect then just what we want to be doing with the Center for Active Living, Healthy Communities, and with Midstate Health. So we were able to address all of these questions in a way that really allowed that program plan to move ahead and work. So here's another example of an objective. By the end of the year, all senior citizens will be offered transportation to the congregate meals. The word congregate means group, or to the group meals. So I ask you to think about what level of objective this is, what's the outcome, who's the target audience, what are the conditions, and what are the criterion. See if you can answer that. So just looking back at Healthy People 2020, there is a very robust mission, vision, and our overarching goals for Healthy People 2020. The vision being a society in which all people live long, healthy lives. That's looking far off into the future and what would be the result if the mission were accomplished. The mission then is fivefold, a little bit longer mission for Healthy People 2020. Identifying nationwide health improvement priorities, increasing public awareness and understanding of the determinants of health, disease, and disability, and the opportunities for progress, providing measurable objectives and goals that are applicable at the national, state, and local levels, and we are using those objectives and goals in our program planning. Engage multiple sectors to take actions to strengthen policies and improve practices that are driven by the best available evidence and knowledge. We're using them as a source for evidence-based practice. And identify critical research, evaluation, and data collection needs. So that is a robust mission for Healthy People 2020. And their goals then, relatively simple and only 4. Attain high-quality, longer lives free of preventable disease, disability, injury, and premature death. Achieve health equity, eliminate disparities, and improve the health of all groups. Create social and physical environments that promote good health for all and promote quality of life, healthy development, and healthy behaviors across all life stages. So you can see that these are bigger, more general statements, not necessarily measurable. The measurable objectives are embedded in each of the goals of Healthy 2020, and I'm sure you've looked at some of those already with regard to your chosen topic areas. I certainly hope you've looked at those. So the developers of Healthy People 2020 felt that the best way to achieve the goals would be to implement the national objectives with an action model or a program model referred to as MAP-IT. And when we get to the chapter on models of program planning, this will be one that we will look at. MAP-IT is an acronym that stands for Mobilize, Assess, Plan, Implement, and Track. And each of the 42 topic areas have objectives. And this is happening, this mobilizing, assessing, planning, implementing, and tracking is the plan structure that they have applied. We are using the generalized model, which is just a little bit different, but still has assess, plan, implement, and track or evaluate embedded in it. So using the ideas established by way of the bibliography, we are next going to step into crafting a rationale statement, which will focus the need and identify possible solutions. And then I'm asking you, after your rationale statement, to craft a mission statement for the program, your program, and to formulate no more than 2 goals for the program. As you can see, goals are broad statement. And this will make up the learning activity number 3 that has been assigned and is posted on Moodle, and I believe I sent this out as an email to all of you as well. The next learning activity, or learning activity number 4, will be to create objectives for your goals. So we'll do that when I meet with you next. Thank you. Bye-bye.